It's pleasure to be invited to the AI4 Pandemic group to give this presentation. So when I prepared the presentation, I looked through the previous seminar series of AI4 Pandemic, and I found most of the talks are related to modeling, AI, machine learning, etc. So today I would like to present a novel approach to support the public health surveillance system, which is based on wastewater. So the title of my presentation today is SARS-CoV-2 in sewer networks to track COVID-19 spread in the community. So I took this picture from the WHO website this morning, and today there have been more than 500 billion confirmed cases of COVID-19 reported to WHO. And behind this number, there are uncountable individual clinical tests have been done worldwide. So we could think about, in addition to the massive individual clinical testing, we could also think about a surveillance strategy at the population level to support the public health system, and the sewage surveillance or the wastewater surveillance, which is also called as wastewater-based epidemiology, is able to reveal the true scale of coronavirus outbreaks in the population. So first, I would like to have a brief background introduction about wastewater-based epidemiology, WBE. So WBE analyzes wastewater to determine the consumption of or exposure to chemicals or pathogens in a population. This is achieved by measuring chemical or biological indicators, what we call biomarkers, in wastewater generated by people contributing to a wastewater treatment plant catchment. So in our sewage network is a basic infrastructure for the society, and the household building, the commercial service building, the industry, they all connected to the underground sewer networks, and the sewer networks are all connected to the downstream centralized wastewater treatment plant for wastewater treatment. So WBE is considered as a novel and cost-effective approach to providing comprehensive health and social information on communities. There are a few key components for WBE. Firstly is the sampling. We need to collect representative samples. Usually, so what a representative sample can be collected. So a representative sample is usually the time-integrative sample, which will represent the wastewater which represent a collection of wastewater for 24 hours, 7 days, or even longer. So we usually take these time-integrative samples rather than the grab sample, because the grab sample can only provide like a snapshot of time in the wastewater, only provide a single time point. So the equipment that we use to collect time-integrative sample is usually autosamplers or passive samplers. The second key point is the analysis technology. We need to use advanced instruments and methodology to detect or to quantify the chemicals at the trace level, or to identify or characterize the unknown compounds. So we usually use the LC-mass high-resolution mass spectrometers for the chemical analysis, and we can also use the PCR and sequencing to do the biological analysis. The third important point is the data collection. We need to collect data to understand our catchment and population better. So the data includes, like the excretion factors and stability of factors of the compounds of the substance that you are going to analyze. So like after you consume or use certain compounds, the compounds will excrete it from the body. with a specific excretion factors. And when the compounds enter the environment, it could also be degraded in the environment. And you need to determine a stability factors to describe the losses, the degradation of the compound in the environment. We also collect the census metadata, geographic information system data, and sewage system operational data to better characterize and quantify the results and link the results to a broader topics. So because wastewater-based epidemiology has been recognized as an effective and robust technique and objective methods, it can be used for many topics, many purposes, like it can be used to track the illicit drug use in the community. It can be used to review the public health conditions by measuring the pharmaceuticals that are used to treat certain disease. And it could be used to analyze the oxidative stress indicators. It can be so by measuring some emerging contaminants, we can also use this method to measure the exposure of population to the emerging chemicals like PFAS and plasticizers. Also, the results can be linked to the socioeconomic factors to evaluate the public health conditions in the community. So as you can see, there are many applications worldwide. So going back to the application to COVID-19, the reason that wastewater testing can be used as an environmental surveillance to complement the clinical-based surveillance is because we can detect the SARS-CoV-2 RNA in wastewater, which are released, excreted from the infected people living in the catchment. The key facts related to this topic is that the RNA of SARS-CoV-2 could be shed from infected people, including both symptomatic and asymptomatic cases. And also the virus shedding could start from pre-symptomatic stage before people show symptoms and go for clinical testing. And sampling at wastewater treatment plants for 24 hours could be used to indicate the SARS-CoV-2 RNA loads in the entire catchment. So since the onset of the pandemic, there have been many studies and research publications in this field about testing COVID-19 in the wastewater to reflect the COVID-19 prevalence in the community. So the COVID-19 wastewater surveillance program have been developed and implemented worldwide because it is able to provide an early warning of COVID-19 incidents, and it could also reveal the COVID-19 prevalence at the population level. So it has been, so this program has been implemented worldwide in Australia, in Europe, in United States, and China. So today there have been many studies and research in this area, and there are many outstanding outcomes and progress. Like it has been demonstrated that the wastewater testing data can well correlate with the COVID-19 infection cases. So this is the figure I took from the BioBot website. You can see the wastewater data can well match with the clinical testing data. And wastewater testing could provide early detection ahead of clinical confirmation, like according to this figure. So this study suggests that the detection of SARS-CoV-2 signals in wastewater could be 48 hours ahead of the clinical confirmation. Also, the wastewater testing could identify asymptomatic cases in, for example, in a target community, like a vulnerable community. So it will enable the early intervention in those communities to prevent the vulnerable people. And wastewater testing could also support COVID-19 surveillance at remote areas and rural communities. This is very important because for wastewater testing, you only need to take one wastewater sample to reflect the health conditions in the entire community. So this is important for those remote areas where the resources, the clinical resources, could be very limited. Also, sequencing wastewater could complement the genomic surveillance for variants, because we are able to identify the variants of concern, variants of interest in wastewater by sequencing the wastewater samples. So before I go into my study, I would like to have a background information of the COVID-19 situation in the Queensland. So as you can see in this figure, the Queensland has we had a very good control of COVID-19 in Queensland from early 2020 to the end of 2021, and then the border was open, and we have to like live with the COVID-19. So the COVID-19 situation in Queensland can be divided into two stages. The stage one, we were nearly able to achieve the zero COVID policy, and then in stage two, we have to start to live with the COVID. And our studies were mostly conducted in stage one. So in stage one, at the very beginning of the pandemic, we selected the wastewater treatment plants at the major cities, which were equipped with the autosamplers to provide the time-integrative samples. So these treatment plants in Queensland, they took wastewater samples every week and sent to our lab, and we measured the SARS-CoV-2 RNA in the wastewater sample using RT-qPCR and sequencing technology. So when we were developing the wastewater surveillance program, we came up with a question like, when we detect a positive detection at a wastewater treatment plant infant, how do we know if these signals, if this SARS-CoV-2 is from the known cases, for example, the quarantine hospital or quarantine hotel, or it's from the community, which could indicate the potential community transmission? And then we realized the answer is no, because wastewater treatment plant, it receives wastewater from the entire catchment, so we cannot distinguish where the signals come from. So we started thinking about shifting the wastewater monitoring from wastewater treatment plant to its upstream catchment, which is the sewage system. So doing upstream sampling will be able to help us detect the emergence of COVID-19 in communities without known sources, like without the quarantine hospital or quarantine hotels. We will be able to detect the emergence of COVID-19 in the residential areas. Taking the samples at the upstream of the catchment will be able to avoid the potential false negative, because the signals of COVID-19 will be less diluted compared to the the high wastewater loading at the influent of wastewater treatment plant. And also we will be able to locate the hotspot areas when we found a certain subcatchment have a higher level of COVID-19 or of SARS-CoV-2 concentration in the wastewater. This could thus inform the target public health actions for the community in those subcatchments. So when we are planning moving the wastewater surveillance from wastewater treatment plant to upstream catchments, then we have the question like, how do we take samples? So like the sewer networks, they're underground. sewer pipes. So it's very hard to assess those underground sewer pipes. So autosamplers that we are usually used at wastewater treatment plants are not feasible anymore, because the autosamplers require external power support, and they are usually expensive and requires regular maintenance and a secure place to install the autosamplers. Apparently, you don't want to install a half cubic meter autosampler on the sidewalk, which is really unsafe. So we started to think about using passive samplers, which could be suitable for upstream sampling, because passive samplers is usually simple, it's portable, it doesn't require any power. The cost to make passive samplers is quite low. It's usually made up of the commercially available consumables such as membranes, swabs, gauzes, and tampons, and it's easy to use. The passive samplers, it's easy to deploy them into the sewage system. Actually, so the passive samplers for chemicals in water environment have been widely used for monitoring chemicals like herbicides, drugs, personal care products, etc. But the application of passive samplers for viruses have been very limited. So we need to answer the question like whether the passive samplers can take a grab sample of virus in the wastewater, or it can provide a time-integrative sample by providing the continuous sampling, continuous monitoring over a certain period. Therefore, we designed the first study to calibrate the passive samplers for virus in wastewater. The aim of this study was to assess the accumulation of virus strain fragments in passive samplers over time. So we used two types of passive samplers here. The first one is called torpedo, which contains swabs, gauzes, and electronegative membranes in a 3D printed housing unit. The second one is a tampon style sampler. As you can see, apparently it comprises a organic cotton tampons and a hair roller. So we prepared a number of these samplers and take them to the wastewater treatment plant influent and deploy them simultaneously and collect them one by one sequentially over 48 hours. In this study, unfortunately, we were not able to measure the SARS CoV-2 on the passive samplers because, as we previously said, we were at stage 1. We could nearly detect any SARS CoV-2 fragments in the wastewater. So we select the other virus for investigations, like the paper mite multivirus, PMNOV, which is a very common indicator virus in the wastewater. And we also use the human adenovirus and enterovirus as the pathogenic viruses. So as you can see in the figure, the black line indicates the accumulation of virus strain fragments or membranes. And as indicated by the straight, the black line, you can see the membrane is able to provide a continuous uptake of virus over 48 hours. And accumulation of virus strain copy on swabs and tampons can be indicated by the blue line and the red lines. As you can see, they have the similar pattern. The virus showed a rapid increase in these sampling materials in the first roughly 8 hours after deployment, and followed by an equilibrium until 48 hours. So we use the linear kinetics to describe the sampling pattern on membranes, and we determine the sampling rates using this equation. And we use the non-linear kinetics to describe the sampling pattern by the swab and tampons samplers, and then we could determine the half-life for those sampling materials. So the important outcomes of the important study is that the membrane could provide linear sampling over time, which outperform the swab and tampon PAPSA samplers. And the sampling rate was estimated as 0.3 to 33 milliliter per hour for 3 virus, PMNOV, enterovirus, and human adenovirus. And for PMNOV, which is the virus with high and stable concentrations in sports water, the sampling rate of the membrane sampler is roughly 1 milliliter per hour. So after knowing that, after calibrate our passive samplers and know that they can provide the time-integrative sampling, the next question is where to sample, where should we deploy these passive samplers in our sewage system? So, sorry, the middle figure shows the layout of sewer networks in a city. As you can see, it's very complex, and the accessible point to this underground sewer network is usually the sewer manhole. For a city like the Brisbane, there are, I believe, more than 5,000 sewage manholes in the city. So how to select the optimal sewage manholes to deploy our passive samplers? This is a question that we need to think about. So apparently, the monitoring area of a sewage manhole couldn't be too large, because if it's too large, it's just like another wastewater influent. It contains too many information from the system, and the virus signal could be largely diluted. And when you detect the positive signals, you still don't know where they come from. Apparently, the sampling point couldn't be too much. Like, you cannot deploy the samplers at each suburbs, which means you need to visit these sites, all of these sites within one day, and the next day you need to visit all of them again to collect the samples, which is very time consuming. So we need to think about the best sampling point, the strategic sampling point in sewer network that could cover this individual subcatchments with maximized population in each individual subcatchment. So in this study, we want to identify the sensitivity of the passive samplers to answer the question, what is the lowest infection rate that allows for the detection of SARS-CoV-2 by a passive sampler? So the infection rate is determined by the infection cases versus the population in a sewer shed in a subcatchment. So knowing the sensitivity of passive samplers for COVID-19 incidence is an important parameter to select sampling location, which decides its monitoring scale and the number of serviced population. Therefore, we designed the second study to check the SARS-CoV-2 RNA in sewage network. The aim of this study is to determine the sensitivity of passive samplers for COVID-19 incidence in the population. So in this study, we select a quarantine hotel, or quarantine hospital, as our target. So this quarantine hospital was considered as the single known sources in the catchment, because there was no community transmission happened during our sampling period. So all the SARS-CoV-2 RNA in wastewater could be were considered to come from this quarantine hospital. So we identified the main trunk sewer connected this hospital to the downstream wastewater treatment plant, and we select 8 sampling points along the trunk sewer network from upstream to downstream. And each sampling point has a service area, and the service area increased from upstream to downstream. So in this study, we conducted 3 sampling campaigns, and in each campaign, there were 13 to 25 COVID-19 patients in hospital. in hospitalization. So the infection rates range from 18.6 to 0.8 from upstream to downstream. The infection rate decreased with the increasing service population connected to the sewage networks. And we used the torpedoes with membranes for this study, and we conducted 24-hour sampling. So the results of this study, in total, we deployed 17 passive samplers into the sewage system, and we were able to detect positive signals of SARS-CoV-2 from 15 of the 17 deployed passive samplers, and we couldn't detect the SARS-CoV-2 signals at the last 2 sampling points, which has the longest distance from the quarantine hospital. And we found the number of SARS-CoV-2 RNA or membrane decrease along sewage networks with increasing dilution from upstream to downstream when there are more people connected to the sewage system, and there are increasing water flow rates in the sewage network. We could also identify a positive relationship between the number of SARS-CoV-2 RNA on the passive samplers and the infection rates in sewer shed. And as shown in this figure, the lowest infection rate that allow for the positive signals on the passive sampler is around 2 cases per 10,000 people, which means that when the infection rate is higher than 2 cases per 10,000 people, the passive samplers will be able to provide a positive detection. But when the infection rate was lower than the 2 cases per 10,000 people, like in this study, when the infection rate was 0.8 or 1.9 cases per 10,000 people, the passive samplers were not able to capture the SARS-CoV-2 RNA gene fragments from the wastewater. So as we previously said, the infection rate is determined by the number of clinical diagnosed COVID-19 cases versus the total number of people in the service area of a sampling point. So, which means that when in a subcatchment, when the infection rate is higher than 2 cases per 10,000 people, the passive samplers will be able to capture the positive COVID-19 signals from the wastewater in this subcatchment. And then we applied the passive samplers, the upstream sampling, using passive samplers to trace the COVID-19 spread in our community. Here I used 2 urban catchments, which is called catchment A and B in Southeast Queensland. And in these 2 urban catchments, we selected 11 sampling points with the accordingly 11 subcatchments in these 2 areas. So all of these subcatchments, we exclude quarantine hospitals or quarantine hotels from this subcatchments. So there was no quarantine, there was no known sources in these subcatchments, and we performed daily or weekly sampling from April to November 2021 in these subcatchments. And in the last day of July 2021, the local health department issued a public health alert of potential community transmission in the city due to a COVID-19 clusters at this indicated area. And then the city was entering an immediate lockdown after the public health alert was issued. So as you can see in this figure, where the COVID-19 clusters was originated from the schools and campus located at the boundary of subcatchment A1 and B1. And in these 2 subcatchments, we conducted weekly upstream samplings in these 2 catchments. So we were able to compare the wastewater testing result to the clinical reports. So this black arrow indicates the timeline of the clinical reports. On the last day of July, the first public health alert was issued, and then the city was entering an immediately lockdown. And after roughly 1 week later, the lockdown was lifted, and then roughly 3 weeks later, the last infection cases related to these clusters was reported. And this heat map showed the wastewater testing results. So the first positive signals in wastewater was tested in 22nd of July in subcatchment A1, which is 1 week ahead of the clinical confirmation. We could continuously detect the SARS-CoV-2 signals in this subcatchment A1 and B1 for quite a while until 9th of September. We detect the last positive signals in wastewater from the subcatchment A1, which is 2 weeks after the final clinical confirmation cases. So the positive signals of SARS-CoV-2 in the wastewater of subcatchment A1 and B1 lasted for 7 weeks, which was much longer than the 3-week clinical record. So we come to our conclusion. Our study demonstrates that passive sampling is a cost-effective approach for monitoring SARS-CoV-2 in wastewater. We demonstrated that membranes could be an effective and sensitive passive sampling technique. It could provide time-integrative sampling over 48 hours following a linear uptake pattern. And the estimated linear sampling rate was roughly 1 milliliter per hour for PMNOV, which is the virus with high and stable concentrations in wastewater. And swabs and tampons, they could also provide the rapid initial uptake, followed by an equilibrium within up to 48 hours following the first order kinetics. So this means that the swabs and tampons, they are able to capture viruses within their effective sampling period, which is roughly 8 hours, suggested by this study. So they can be used to provide a short-term monitoring, like in the early morning. They could be used for like a few hours monitoring in the subcatchment in the wastewater. And our study suggests that the upstream sampling is able to track the spread of viruses at the low case settings or at small population level. The upstream sampling can enable early detection of infection cases before the broader community transmission happened. And we found a positive correlation between the number of SARS-CoV-2 RNA or membranes and the infection cases in the population. We determined the sensitivity of membranes for COVID-19 incidence around 2 cases per 10,000 people. And we found that the upstream sampling is able to reveal the spatial temporal change of SARS-CoV-2 in different areas and community within a city. So because this presentation is for the AI4Pandemic group, I would like to give a short update about the application of AI for wastewater-based epidemiology for COVID-19 surveillance. So there is a recent paper about using ANN model to estimate COVID-19 case numbers based on the over 10,000 WBE data collected worldwide. And the model inputs include the wastewater testing data and the other relevant data such as weather, clinical testing, and vaccine coverage. And as you can see in the right figure, the ANN model can accurately estimate COVID incidence and prevalence rate in the population. And the model also reports a lead time of early warning of incidence about 2 to 4 days ahead of the clinical confirmation. So actually, when I do the literature review, I found that the application for AI for other wastewater-based epidemiology application are still very limited. As we previously discussed, WBE has been widely applied for estimating illicit drug use, to assess public health conditions, to evaluate the chemical exposure and link to the social economic factors. And there are more and more new chemicals can be identified in wastewater when the new methodologies are being developed. So I could see so we have generated a large amount of data based on wastewater testing, and I believe there could be a great opportunity and a great potential to apply AI for WB study. When we integrate the analytical data based on wastewater, we integrate the GIS data for the catchment that we are monitoring and the census metadata, which can provide very accurate information at the mesh block level, and the human-related data like the excretion of a substance of compounds from the human body, to foster the development, to foster the application of AI for WBE area. So that's the end of my presentation today. Thanks for your listening, and I would like to acknowledge the QUASE COVID-19 wastewater surveillance team from the University of Queensland, CSIRO, who did the testing, Queensland Health to support this program, and Urban Utilities to support our upstream sampling campaigns. So that's all. Thank you.
Thanks, Jiaying. Are there any questions?
Yeah, I'm interested. How far can you push the upstream sampling? So, for example, if you've got a large retirement home, maybe with 500 residents, would it be practical and economically viable to have testing, at the outlet for the whole home? I mean, I guess you prove that you can put the passive samplers in, but then you need to collect them, don't you, on a daily basis, and there's the cost of the actual identification of compounds through whatever method you use. But would that possibly be worthwhile, given that it gives you a 3 to 4 day, sort of time window where they could perhaps change their operations if there was, somebody who'd actually contracted it but was asymptomatic?
So this is a very good question. So the fact that we conducted upstream sampling was actually in stage 1, where we tried to identify any potential community transmission in the community. And during that period, usually the government didn't encourage too much outdoor events. So the population movement in the catchment was actually a little bit relatively limited. And when we select the upstream catchments, we usually divide the subcatchment by roughly 50,000 per subcatchment. And so we divide the whole catchment to 4 to 6 or 7 subcatchment in each catchment. So each subcatchment has roughly 20 to 50 population living in those subcatchment. And then we collect samples. We collect 24-hour samples, and then we took sample back to the lab, and we will be able to analyze the samples and provide the results within 24 hours. So the transit time is roughly 48 hours. So we will be able to provide whether there is any positive signals detected in this subcatchment within 24 hours, and then we report the values to the health department to tell them to update the results in these subcatchments. And also for we also do the it's actually not upstream sampling, but passive samplings in those remote areas, the regional councils, which only has, so what the catchment in the regional area is usually less than 10,000 people in each catchment. So the passive samplers is able to provide a positive detection if there is 1 or 2 infection cases visit that catchment. And the remote areas, the regional councils, they deploy the passive samplers once a week. Sometimes not 24 hours, but they could also deploy them for a longer period, like 2 to 3 days, and they send the passive samplers back to us using the Star Tracker or OSIPOS or the courier. And then once we receive the samplers, we analyze the samplers on the day of collection and give the results, report the results to the public health and also the local council. So the transit time. So we will be able to update the information at least once a week for major city or for regional councils.
Thank you.
Any more questions?
Yeah, I can ask a question.
Yeah.
Yeah, thanks, Jiaying. That's a really interesting talk. A couple of questions. So is your data available from this study?
Yes. So previously, the data is available on the Queensland's website. There is a portal called Queensland Wastewater Surveillance Program in Queensland Health website. And now I think they recently updated the website and provide the raw data on the website. So if you go to if you search Queensland Wastewater Surveillance for SARS-CoV-2 for COVID-19, and I think you will find a website that provides the analytical data from 2020 to now. I think they updated the website recently.
Okay, cool. Thanks. And I was also wondering about the kind of time delays in the sewage system, I guess. So I imagine that it takes some time for sewage to flow through the system, say in the Brisbane area or whatever, and estimating the amount of time that it takes from some place to some other place is probably a difficult problem, right? Is that how do you deal with that?
Actually, it flows much quicker than you expect. So for the area in Brisbane, what we call hydraulic retention time in the catchment is within 6 hours from the very upstream to the downstream treatment plant. So the treatment process in the treatment plants is longer. Like it might take a few days to treat wastewater, but for the water flows within the upstream sewage catchment is very quick. So for a Brisbane area from the Gap or the Mancusa to the luggage point, the airport, the wastewater usually it only requires 6 up to 8 hours to flow there. So that's why we collect 24-hour sampling to cover the human activities within a day. Yeah.
Okay. Would that be different in somewhere like London or Shanghai or something?
Usually the retention time in the sewage system is less than 12 hours worldwide. Okay. For the biggest catchment, it's also, I believe, less than 12 hours. Yeah, for the small catchment, it could be just 2 to 3 hours.
Yeah. Cool. Thank you.
Thanks. I put is that the website for the data, Diane? Like I put on the chat.
Let me check. Yeah, I believe so. Yes, I didn't open that file, but I believe it contains the results from this program. Yeah, I think they updated the website recently, so I'm not sure whether it's stable now, but I think they will be able to provide the raw data later, very, very, very soon.
Okay.
Could I just ask quickly about the July 2021 outbreak in the city where you had, like maybe 7 or 8 days early warning? Did you have a system for feeding the information through to the government? In other words, was that part of the, because they didn't actually close down until the first clinical case, did they? But were you able to provide information into some sort of government decision making there? Did you have those links in place?
So this program was supported by Queensland House directly. And the reason why the Queensland House didn't make an immediately action after the first detection of wastewater was because what we call the Indra-Pili outbreak was the first public health, was the first community outbreaks in Brisbane, right? So the Queensland House, they were not sure whether it was just a random pickup of SARS-CoV-2 from somebody, like from the overseas travelers out of quarantine in the catchment, or from somebody else. They didn't how to say, I don't know the proper way to say that, but they didn't trust the wastewater-based data that much at the very early stage. But after that, I believe they developed the confidence in the wastewater data. And once we identify especially when we detect the positive data from the regional council, they report, they exchange the information to the regional councils very quickly and tell them that there could be some travelers carry this COVID visiting your catchment, so be careful and whatever, do some preparation for this.
Right. Thank you.
Any more questions? Okay, no more. All right then. Let's thank Jiaying for joining us today. It's a great talk. Okay, thanks so much.
Thank you for inviting me.
Yeah. All right. Okay, thanks everyone. Okay, bye.
Thank you. Bye.